Maryland Spotlight. It's all about Maryland living.
Welcome to Maryland Spotlight. I'm Kim Knight. Well, do you suffer from sinus problems? Yeah, it's that time of the year. Well, my next guest can help. Dr. Praveen Duggal, ear, nose, and throat, also a rhinologist from Severn River ENT. Welcome.
Thank you very much for having me.
Yeah, what is a rhinologist?
So a rhinologist is a fancy word for saying nose and sinus specialist. After around 5 years of ear, nose, and throat surgical training, one can elect to do a year of fellowship after you're board certified to specialize just in nose and sinus problems or disorders. So that can range from minor issues like deviated septums or allergies to things like chronic sinusitis or nasal polyps or even nose and sinus tumors. There's only a handful of rhinologists actually in Maryland. I believe I'm the only one in Anne Arundel County. So if you're sitting down and having a consultation with a rhinologist, you know you're really meeting an expert in that field, as well as someone that really has a passion for helping those patients with the nose and sinus problems.
Sure. Now, this is definitely the time for sinus problems, right?
Yes, it is. Yes, it is. So sinusitis is really a problem that can affect the sinuses. And what are the sinuses? They're air or hollow-filled cavities inside the head that we have on either side. And they allow for airflow and mucus to travel and prevent a buildup or backup of dust particles, allergens, pollutants. What we don't want is a backup because that can then lead to infections, and a lot of people have those. And often the symptoms associated when there is a backup are things like nasal congestion, facial pressure and pain, a lack or change in smell, headaches, a lot of mucus drainage. And so these are very common symptoms for a lot of people across the country. About 35 million Americans have this problem.
My husband included. So how is it treated?
So there's a lot of different ways of treating sinusitis, but initially in the first few days, most over-the-counter remedies you can get at any pharmacy are pretty good. I recommend a lot of saltwater rinses, the neti pot, things like that really wash and flush things out. But if people are having symptoms for lasting longer than a week or 2 weeks, most medical providers will provide antibiotics. Generally, this takes care of the problem. However, if that doesn't seem to work, and a lot of people have this issue, you get better, then it gets worse. You get better, then it gets worse. Or you have chronic sinus problems lasting months and months. Sometimes other interventions are needed, which is where I kind of come in and help with procedures either in the office or in the operating room that will have minimal downtime and really maximize people's benefits and relieve their symptoms.
So quickly, talk about balloon sinuplasty.
So balloon sinuplasty is a technology that we now have that allows us to minimally, it's a minimally invasive technique, that we're allowed to place a small balloon catheter inside the nose and open and dilate small tiny openings or obstruction. If you can imagine the sinus is like the plumbing in your house, sinusitis is kind of like blockage of the plumbing. So the balloon helps to open up the blockage and allow for better airflow and mucus flow to relieve symptoms.
Terrific. Well, it's a great solution. I think I'll send my husband your way. KleinmanMD.com is the website. Doctor, thanks for being with us today.
Thank you very much.
And thank you all for joining us on Maryland Spotlight. I'm Kim Knight.